we discussed the 5 transporting points, being spring points, liver 2, moving between. Location between the first and second toes, proximal to the margin of the interdigital web. How to find, locate liver 2 slightly proximal to the margin of the interdigital web between the first and second toes. Located in comparable position are the stomach floor between the second and third toes and GB43 between the fourth and fifth toes. Liver 2, stomach 44, and GB43 are all part of the extra point. EX10, the buffet. Its bottom of the hand is the extra point, EX UE9, the boxy. Needling 0.3 to 0.5 June, obliquely towards the heel, vertically. Action indication, it clears liver fire, spreads liver chi, comes internal liver wind, clears heat and blood heat, stops bleeding, benefits the lower burner. Special features, it is a yin spleen point, fire point, sedation point, major point for excess syndrome of the liver, especially the liver fire. Liver 2 is the point to drain liver fire. It is a point which is only used to drain the liver in excess patterns, mostly to drain liver fire, but also to subdue liver yang and extinguish liver wind. Since it drains liver fire, it is used for bitter taste, thirst, and red face, headaches, dream-disturbed sleep, scanty dark urine, constipation, red eyes, a red tongue with thick yellow coating, and a rapid wiring pulse. Since it subdues liver yang, it is widely used to treat migraine headaches from rising liver yang. As it expels interior wind, liver 2 is used for epilepsy and children's convulsions. Liver 2 has important blood cooling action, which is used to stop bleeding from blood heat. The blood cooling action is related to its fire draining action. As the liver stores blood, when the liver has fire, this is transferred to the blood heating grid. Blood heat is a major cause of bleeding. Indeed, bleeding is an important potential consequence of liver fire, which helps to distinguish it from liver heat or liver yang rising, which do not cause bleeding. Liver 2 is also main point to clear liver fire when this causes cough from liver insulting the lungs in insulting cycle of the 5 elements. The simple question in major 38 says, each of the 5 yin and 6 yang organs can cause cough. Cough caused by the liver is accompanied by pain below the ribs. In severe cases, the person is unable to turn the body and has a sensation of swelling and fullness below the ribs. In these cases, liver fire insults the lungs and obstructs the chest, causing cough and breathlessness. Okay, this is frequently accompanied by phlegm, which combines with the fire of the liver to ascend to the chest. Summary, drains liver fire and subdues liver yang. In bitter taste, headache, thirst, dark urine, dry stools, irritability, propensity to outburst of hunger, red eyes, dizziness, tinnitus, eye pain, feeling of heat. It also extinguishes interior wind, in wind stroke, deviation of eye and mouth, tetany, epilepsy, loss of consciousness. Cools blood, stops bleeding, excessive menstrual bleeding, coughing of blood, vomiting of blood. It also calms the mind in propensity to outburst of anger, sadness, fright, seeing ghosts, manic behavior, insomnia, palpitations. It also resolves the acute in genitourinary system, in pain and itching of the genitals, pain in the penis, hernial and genitourinary disorder, painful urination, retention of urine, difficult urination, turbid urine, excessive vaginal discharge, constipation, abdominal distension. One special condition for which liver 2 is indicated is the symptom of hands and feet counterflow cold, where only the hands and feet are cold, but the body is warm. This may occur in the pattern known as true heat, false cold, where the heat constraint in the interior prevents yang qi from circulating to the limbs. Despite the apparent cold, the other symptoms, as well as the pulse and the tongue, are indicative of heat and constraint. In clinical practice, this symptoms is often encountered in patients with liver qi stagnation rather than heat, where the stamen qi prevents the adequate circulation of qi to the extremities. According to the spiritual pivot, the liver governs the sinews, and liver 2 is indicated in many classical sources for pain in the liver region. Although more commonly described as kidney deficiency or painful obstruction, stagnation of liver qi or liver blood deficiency may also give rise to lumbar pain due to contraction and inflexibility of the sinews. However, the frequency with which the liver 2 appears in classical combination for lumbar pain points more towards an empirical application rather than a theoretical one. Finally, liver 2 is indicated for swelling of the knee, pain of the inner aspect of the leg, heat in the shins, and pain and swelling of the instep, and the sum of points for miscellaneous diseases for leg and knee pain to bed liver 2. Thank you for your attention.
Let's discuss spleen 3, supreme white, a shoestring point. Spleen 3 is located on the medial aspect of the foot in the depression proximal to the head of the first metatarsal bone at the border of the red and white skin. How to find spleen 3? When palpating along the border of the red and white skin on the medial aspect of the foot from distal, the toes, to proximal, the ankle, the metatarsophalangeal joint forms a prominent landmark. Spleen 3 is located just proximal to this joint in a clearly palpable depression, which marks the junction of the head and the shaft of the first metatarsal bone. Located in a comparable position is bladder 65, proximal to the head of the fifth metatarsal bone on the lateral border of the foot. In comparable locations on the borders of the hand are LI3 on the radial aspect and SI3 on the ulnar aspect of the hand. Needling 0.5 to 1 soon vertically or obliquely from medial towards lateral. Caution, needling this point tends to be painful. Actions, indications of spleen 3. Tonifies spleen, harmonizes lower burner, eliminates dampness and damp heat, regulates qi locally. Special features: yuan source point, shoestring point, earth point, pen point, 5 faces. Important point for tonifying the spleen. Spleen 3 is a major point to tonify the spleen, as it is the source point of the channel and also the earth point of an earth channel. As the spleen belongs to earth, which is at the center of the 5 elements, the source point of the spleen is the center of the center. It is very frequently used to tonify the spleen in any of its deficiency patterns. Spleen 3 stimulates the mental faculties pertaining to the intellect, which are associated with the spleen, and it can be used in cases when spleen qi has been weakened by excessive mental work. The use of spleen 3 can then stimulate the brain, promote memory, and induce mental clarity. This point is useful to stimulate mental powers in patients suffering from post-viral chronic fatigue syndrome. Another important function is to resolve dampness, for which it is a major point. It is used in any dampness pattern in the upper, middle, or lower burner. When used to resolve dampness, it should be needled with reducing method. Examples of symptoms and signs of dampness are confused thinking, feeling of heaviness and mozziness or fuzziness of the head, feeling of fullness of the epigastrium, no appetite, feeling of heaviness of the body, and sticky tongue coating. Spleen 3 is particularly useful to resolve dampness from the head, where it causes a feeling of heaviness and muzziness of the head and a dull frontal headache. Spleen 3 is also frequently used in chronic retention of phlegm in the lungs. Phlegm is retained in the lungs, but it originates from the spleen due to impairment of its function of transportation and transformation. Reinforcing spleen 3 can at the same time tonify the spleen to strengthen the lungs. This is strengthening the earth to nourish metal and resolve phlegm. A more unusual use of this point is to strengthen the spine. According to Chapter 4 of the Simple Questions, the spleen controls the spine. Spleen 3 is a very useful point to strengthen and straighten the spine in cases of chronic backache. To summarize, spleen 3 is a major point to tonify spleen, stimulates intellect and mental faculties, regulates intestines, abdominal distension and pain, diarrhea, resolves dampness, particularly from the head, resolves phlegm and strengthens lungs, strengthens the spinal muscles. Spleen 3 is the shoestream yuan source and earth point of the spleen-earth channel and has a powerful action on strengthening and regulating qi of spleen and stomach. The spiritual pivot in Chapter 6 recommends the use of shoestream points in treatment of Zhang disorders, whilst in Chapter 1 it says, when the 5 Zhang are diseased, select from the 12 yuan source points. The classic of the Jade Dragon clearly states that spleen 3 is indicated for deficiency and feebleness of the spleen and stomach. Since deficiency of the Zhang Fu easily leads to excess dampness and consequent obstruction of qi, spleen 3 is an important point for treating both primary deficiency and the subsequent excess that is often generated. It should be noted that spleen 3 is also strongly indicated for various symptoms characterized by distension and pain in the abdomen, epigastrium, chest, heart, and lateral costal region. These are due to stagnation of qi, which may arise either due to qi deficiency, in other words, when there is insufficient qi to maintain smooth circulation, or when accumulation of turbid dampness obstructs the smooth movement of qi. In the former case, the pulse and tongue will reflect deficiency only, and the treatment principle is to reinforce spleen 3, according to the theory of treating by opposition. In this case, to treat fullness by filling. In the latter case, pulse and tongue will show signs of excess, and the treatment principle is to reduce spleen 3. Spleen 3 is frequently used for disorders of the joints of the big toe and the head of the first metatarsal bone. Thank you for listening.
Still on the extra points, today we discuss 2 more extra acupuncture points, namely Tituo, or the lift and support point, also called the EXCA extra point, and the Dingchuan, or the cam dyspnea, or acupuncture point, or the EXB1 extra point. So let's start with EXCA, the lift and support acupoint, or the Tituo extra point. This point is located 4th zone lateral to the anterior midline and 2th zone superior to the upper border of the pubic symphysis. So how to find this point? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 proportional zones, which can vary considerably from the patient's finger zone. Therefore, only the proportional zone measurement should be used using a helpful device like an elastic tape from the upper border of the pubic symphysis, measure 2 zone in a cranial direction, and from there, measure 4 zone in a lateral direction. There, medial to the ASIS, locate T2, or the EXCA extra point. Located on the same level are kidney 13, which is 0.5 zone lateral to the midline, EXCA, which is 1-2 lateral to the midline. So stomach 28, which is 2-2 lateral to the midline. And another EXCA acupuncture point or extra point, the Schumann, which is 3-2 lateral to the midline. GB27 is located medial to the ASIS, approximately on the same level. Needling this point is done vertically 0.5 to 1 tune. Caution should be exercised as the peritoneal cavity lies beneath this point, and also we should exercise caution during pregnancy. For its actions and indications, this point strengthens the rising qi and alleviates organ prolapse. Special features: in modern TCM, Tituo is considered one of the most important points for prolapse of the uterus. T2, or the lift and support point. Its location is on the lower border of the lower abdomen, which is 4-tune lateral to the midline, level with REN4. Its actions: raises qi, it invigorates blood. Here we have an illustration showing where T2 is located relative to the other extra points, namely Jingshong, Shimen, and Zikong. Indications for the use of T2. First, it's indicated for prolapse of uterus. It's also indicated for painful periods, abdominal pain, abdominal masses, and myoma. T2 is an important local point for abdominal pain and abdominal masses from blood stasis. It affects blood in the penetrating vessel. In modern China, this point is frequently used for myoma or fibroids. Okay. To summarize, T2 raises qi. It's indicated for prolapse of the uterus. It also invigorates blood, so it's good for painful periods, abdominal pain, abdominal masses, and myoma. Okay. T2 is a modern extra point and is one of the primary points for the treatment of uterine prolapse. In combination with other points, it is for the prolapse of uterus, T2 or NCA-4 is used in combination with DO20, stomach 36, and spleen 6. Next, we have the calm dyspnea or the Dingchuan extra point, the EXB1 extra point. EXB1 is located 5-tune lateral to the lower border of the spinous process of the 7th cervical vertebra. How to find Dingchuan? First, identify C7, and next, measure 0.5 tune from the lower border of the spinous process in a lateral direction and locate TXB1. Located on the same level are DO14 on the midline, SI15, which is 2 tune lateral to the midline, and EXB, which is 3.5 tune lateral to the midline. Needling this point is 0.5 to 1 tune in a medial direction. For its actions and indications, this point harmonizes lung qi and a local point for the neck and shoulders. Special features, it's the modern main point for dyspnea. Dingchuan in stopping asthma. So again, this point is located 0.5 tune lateral to DO14. Actions promotes descending of the lung qi and calms asthma. Here is an illustration showing do 14 and where is Dingchuan. For its actions and indications. Dingchuan is indicated for asthma, wheezing, breathlessness, and cough. This point is mostly used to calm an acute attack of asthma. So again, this point promotes the descending of lung qi and calms asthma in asthma, wheezing, breathlessness, and cough. Dingchuan is a modern addition to the extra points and is one of the primary points for the treatment of acute wheezing, dyspnea, and asthma. In combination with REN22 and lung 6, it can be used to treat acute asthma. Thank you for your attention.
We continue with the back transporting points, ladder 52, residence of the will. Location, retune lateral to the posterior midline on the level of the lower border of the spinous process of the second lumbar vertebra, L2. How to find for orientation in the lumbar region? First, locate top ear line. Place both hands superior or lateral to the highest point of the iliac crest, joining the thumbs in the middle above the spine. In most cases, this line intersects with the spinous process of lumbar 4. Note this varies depending on the patient's position. From there, count upward to the lower border of the spinous process of L2, and on this level, locate ladder 52, retune in a lateral direction. Locate on the same level or do 4 on the midline, a point of EXB2.52 lateral to the midline, and ladder 23, 1.52 lateral to the midline. Needling vertically or obliquely, 0.5 to 1 tune. Caution, kidneys. Action indication, it tonifies the kidney. In essence, regulates urination, benefits the lumbar region. Ladder 52 is outside ladder 23, the back transporting point of the kidneys. Similar to ladder 23, it has a tonifying effect on the kidneys, and combined with it reinforces its effect. Ladder 52 can be used in chronic lower backache, especially if the point is tender on pressure, as it strengthens the back by tonifying the kidneys. This point also nourishes the essence and can be used in male sexual problems such as impotence, lack of sexual desire, and premature ejaculation. In women, it is an important point for the treatment of infertility from a kidney deficiency. Finally, this point strengthens willpower and determination, which are the mental spiritual phenomena pertaining to the kidneys. It is a very useful point in the treatment of certain types of depression when the person lacks motivation and drive and lacks the willpower and mental strength to make an effort to get out of this spiral of depression. Enabling this point with reinforcing methods, especially if combined with bladder 23, will stimulate the willpower and lift the spirit. Ladder 52 strengthens willpower, drive, determination, and capacity of pursuing one's goal with single-mindedness, spirit of initiative, and steadfastness. This point, if there is kidney deficiency in combination with one of the other 4 points affecting the spiritual aspect of the yin organ, that is bladder 42, bladder 44, bladder 47, bladder 49, as a solid mental emotional foundation for the other aspect of this side. The following are some examples of such combinations. Bladder 23, bladder 52, bladder 47 to strengthen willpower and drive and to instill a sense of direction and aim in one's life. This combination is excellent to treat the mental exhaustion lack of drive, and aimlessness and confusion, which is typical of chronic depression. Bladder 23, bladder 52, and bladder 49 to strengthen willpower and drive and empty the mind, the shed, and intellect, the ye of obsessive thoughts, worries, and confusion thinking. The bladder 23, bladder 52, and bladder 42 to strengthen willpower and drive. Settle the corporeal zone, the poop, and release emotion, constraint in the chest and diaphragm. Bladder 23, bladder 52, and bladder 44 to strengthen willpower and drive, calm the mind, and relieve anxiety, depression, mental restlessness, and insomnia. This combination harmonizes kidney and heart, and therefore willpower and mind on the mental emotional level. It also tonifies the kidney in the essence, in exhaustion, dizziness, tinnitus, backache, weak sexual function, impotence, infertility, premature ejaculation, nocturnal emissions. Benefits urination in difficult urination, dribbling urination. Strengthens the back in chronic lower back ache, sciatica. Strengthens the willpower in depression, lack of motivation, lack of drive, lack of willpower. Bladder 52 in conjunction with one of the other points of the outer bladder line, bladder 42, bladder 44, bladder 47, and bladder 49. Bladder 52 is level with bladder 23, the back chute point of the kidneys. Despite the suggestive name, residence of the will, there are no apparent references in any of the important classics of acupuncture to the use of this point for the treatment of emotional or psychological disorders. Bladder 52 was also known as palace of essence, reflecting its ability to fortify the kidney qi and yang, strengthens the sexual function and control discharge of semen, as evidenced by its indication for impotence, premature ejaculation, and seminal emission. It is similarly able to firm the kidney qi, regulate urination, and is indicated for difficult or dribbling urination and edema. Bladder 52 is also used clinically in the treatment of pain that spreads widely to the muscles of the lumbar region, whether due to sprain, painful obstruction, or deficiency and disease of the kidneys, for example, renal colic. Unlike bladder 23, however, the application of bladder 52 is confined to these patterns of kidney deficiency, and it lacks the wider ability of bladder 23 to deeply nourish and tonify the kidneys. According to the essential questions, the 5 outer bladder points level with the 5 sang bakshu points, that is the bladder 42, bladder 44, bladder 47, bladder 49, and bladder 52, drain heat from the 5 sang, an action shared by the bakshu points of the 5 sang. Thank you for your attention.
Now let's talk about the stomach sinew channel. The stomach sinew channel begins as a wider band encompassing the second, third, and fourth toe, traverses the dorsum of the foot, binds at the tibial depression, and divides into 2 branches. One branch obliquely ascends the anterolateral aspect of the leg and binds at the lateral aspect of the knee. It then ascends the anterolateral aspect of the thigh and binds at the anterior hip region. From there, it sends a branch to GB30 in the direction of the greater trochanter. The sinew channel travels from the anterior hip region across the lateral abdomen and spreads across the lower rib cage posteriorly to the spine. Another branch follows the tibia on the anterior aspect of the lower leg and binds at the level of the patella. From there, a branch runs to the head of the fibula, where it meets the GB sinew channel at GB34. From the patella, the channel ascends along the anterior aspect of the thigh, binds in the inguinal region, passes REN2, and binds at REN3. It then ascends across the abdominal and thoracic region and reaches the supraclavicular fossa to bind at stomach 12. It then continues along the anterolateral aspect of the neck and binds at the angle of the mandible. At the angle of the mandible, the channel divides into 3 branches. One branch terminates anterior to the ear. A further branch ascends to the zygomatic bone, where it meets the other yang sinew channels at SI18. The third branch circles the mouth, ascends to the upper nose region, there connects with the bladder sinew channel, and then spreads along the lower eyelid. The bladder sinew channel spreads along the upper eyelid so that the 2 channels together form a network around the eyes. Clinical importance of studying the stomach sinew channel. Pathology. There will be stiffness and aching of the toes, leg cramps, the gastrocnemius and quadriceps muscles, stiffness and pain on the dorsum of the foot at stomach 41, swelling and tension in the inguinal region, Shan disorders, cramping in the abdomen as well as in the supraclavicular fossa and the face, facial paralysis, weakness and paralysis of the superior rectus muscle. Indication. We mainly use the stomach sinew channel for P syndromes, painful obstruction syndromes, along the stomach channel. The area covered by the stomach sinew channel is larger than that covered by the stomach primary channel. This explains why the indications of points on the stomach primary channel include disorders and diseases of the external genitalia, for example, urinary tract disorders such as cystitis, hernia, and orchitis, which are often treated in combination with liver points, as well as disorders of the eyelids and of all sensory organs. So here is a more simplified illustration of the stomach sinew channel. So it begins on the middle 3 toes, binds above the genitals, and binds at the hip, connects with the spine, and then binds in front of the ear, while another branch would join with the bladder sinew channel to form a muscular net around the eye. The stomach channel of foot yang ming is interiorly, exteriorly coupled with the spleen channel of foot tai yin and paired with the large intestine channel of hand yang ming according to 6-channel theory. The stomach-spleen relationship is further strengthened by the fact that the stomach primary channel enters the spleen. The stomach divergent channel disperses in the spleen. The stomach luo connecting channel from stomach 40 joins with the spleen channel. In addition, it is clinically valuable to note that the stomach primary channel enters the upper gum, then joins with the governing vessel at DU26, circles the lips, and joins with the conception vessel at REN24, thus connecting with both the upper and lower teeth. The stomach channel ascends in front of the ear and meets with the gallbladder channel, which enters the ear at stomach 7. The stomach luo connecting channel terminates at the throat, whilst the stomach primary channel descends through the throat region. The stomach divergent channel penetrates the heart, whilst the stomach primary channel ascends to meet the governing vessel at both DU24 and DU26. The stomach primary channel descends through the breast and nipple. The stomach primary channel descends to cross the chest, epigastrium, and upper and lower abdomen. A branch of the primary channel terminates at the lateral side of the middle toe, the only channel to go to this toe. Thank you for your attention.
Let's now explore the forearm and hand as we continue with location methods and soon measurements. For locating points on the forearm, it is important to note whether the arm is in a pronated or supinated position, since this can have a considerable effect on the relative location of some points. For example, in supination, the line connecting LI5 and LI11 runs along the lateral border of the forearm, while in pronation, it traverses the forearm. So first, we discuss about the styloid process of the radius. The styloid process forms a flat mound on the anterior and lateral aspect of the distal end of the radius. An oblique groove can be palpated at the transition from the process to the shaft of the radius. This is the location of lung 7 and lung 8 is located slightly more distally and anteriorly at the border of the process. Next, we have the styloid process of the ulna. The styloid process of the ulna is located at the distal end of the forearm, at the distal end of the ulna, forming a distinct prominence. With the elbow flexed and the forearm in a supinated position, a small groove becomes palpable by sliding the groove of the tendon of the extensor carpi ulnaris muscle. This is the location of SI6. Next, we have the anterior wrist joint space, or the most distal wrist crease. Chinese textbook on acupuncture are use the most distal wrist crease as a reference for points around the wrist joint. However, since the location of the crease can vary, the space between the proximal row of the carpals and the ulnar radius should be used instead. By gently moving the wrist joint, the space can be clearly felt. In the proximal row of the carpal bones, the prominent pisiform bone marks the ulnar end, its proximal border serving as a bony landmark for locating the anterior wrist joint space, where heart 7 and pericardium 7 and lung 9 are located. Next, we have the pisiform bone and tendon of the flexor carpi ulnaris muscle. The pisiform bone is an important reference point on the ulnar aspect of the wrist joint. Here, the insertion of the tendon of the flexor carpi ulnaris muscle marks the location of several points of the heart channel, namely heart 7 and heart 4 are lined up on the radial aspect of the tendon. Next, we have the dorsal wrist joint space, or the dorsal wrist crease. For the location of points on the dorsal aspect of the hand and forearm, many Chinese textbooks quote the dorsal wrist crease for anatomical reference. Since this crease may vary in location, the space between the proximal row of the carpal bones and the radius or ulna should be used instead. This space can be easily palpated by gently moving the wrist joint. Here we can find triple burner 4, extra point EXUE3, and those points. Triple burner 4 and EXUE3. Okay. Next, we have the pisiform bone in the ulnar border of the hand. On the ulnar border of the hand, distal to the wrist joint space, the pisiform bone is again a good landmark for orientation. It can be felt as a distinct prominence between the joint space and the head of the fifth metacarpal bone, separating SI4 at the distal end and SI5 at the proximal end. Next, we have the anatomical snuff box. With the thumb abducted, the anatomical snuff box forms a depression at the radial aspect of the wrist joint space, which opens towards the body when the hand is held in a horizontal position. It is bordered by the tendons of the extensor pollicis longus and the brevis muscles. LI5 is located in the snuff box. Thank you for your attention.
We continue with the window of heaven points, REN22, heavenly prominence. Location, 0.5 June superior to the sternum in the center of the suprasternal fossa. How to find this point is best located with the patient in the supine position and a pillow under the shoulders or seated with a comfortable and safe head support. Locate the center of the suprasternal fossa approximately 0.5 June superior to the sternum, and there locate REN22. Needling initial vertical insertion 0.2 June in order to penetrate the skin. Then direct the tip of the needle inferiorly and continue to insert the needle parallel to the posterior aspect of the sternum up to 0.5 to dangerous point. Wrong insertion technique, for example, vertical or oblique retrosternal needling, may lead to injury of the big vessel and organs inside the mediastinum. This point should only be needled by experienced practitioners. Action indication: descends counterflow lung qi, alleviates coughing and dyspnea, benefits the throat. Special features: meeting point with the yin wei mai, window of heaven point, important emergency point for acute asthma attacks. REN22 stimulates the descending of lung qi and is widely used in both acute and chronic cough and asthma. It resolves phlegm in the throat and lungs and promotes the expelling of sputum. It is used in acute situations such as acute bronchitis with profuse sputum or chronic retention of phlegm in the throat. REN22 is an important local point for problems of the throat and voice. It stimulates the descending of lung qi and cough, wheezing, breathlessness, rattling sound in the throat. It resolves phlegm in the throat. It benefits the throat and voice, feeling of obstruction in the throat, ulcers, swelling in the throat, dry throat, hoarse voice, sudden loss of voice, goiter. In common with many points of the concession vessel, REN22 has a strong action on descending qi. Located in between the lungs and below the throat, its principal application is in the treatment of a wide variety of disorders affecting these two areas. REN22 has long been recognized as an important point to treat lung disorders. For example, the essential questions recommend it for rebelliously, inability to breathe, and shortness of breath. Like other points suited in the uppermost position of the chest, lung 1, REN22 is principally used to treat excess patterns characterized by upward rebellion of lung qi, including cough, asthma, sudden dyspnea, inability to breathe, and lung abscess with purulent bloody coughing. As far as throat disorders are concerned, REN22 may be used in virtually any clinical situation, ranging from dryness, cold sensation, swelling, and pain, to plumstone qi and severe ulceration, which prevents eating. It is also an important point for disorders of the voice, including cracked voice, loss of voice, and inability to speak. In modern clinical practice, the most common application of this point is in the treatment of wheezing and asthma, especially when accompanied by accumulation of phlegm in the throat. REN22 is a meeting point of the conception vessel with the yin linking vessel. The yin linking vessel ascends through the chest region, and according to the classical difficulties, when the yin linking vessel alone is diseased, it will cause heart pain. REN22 is specially indicated for obstruction of qi with heart pain and pain of the heart and back. Finally, REN22 is one of 10 points listed in Chapter 2 of the Spiritual Pivot that have come to be known as Wind of Heaven points. For a fuller discussion, so you can check that page. It illustrates many of the characteristic action of these points in its ability to treat goiter, rebellious chi of the lungs and stomach, and sudden onset of disorders, sudden loss of voice. The windpipe is like the chimney of the upper jaw. This point lies at the bottom of the chimney, but movement needs to or in both direction. The neck is a bridge to heaven. You are entering transitional territory with this point. With the in-breath, ability passes this point, and when this point is needled, chi rushes forward. When a person feels disconnected from their heaven, physically or at the level of the spirit, they can appear remote and stultified, oppressed, all senses dull. Without the free flow and animation of heavenly influxes reaching the upper Dingchuan and the home of the heart, the individual, they find no authentic communication within themselves or with others. This point allows the free communication of spirit and chi, helping bring refreshment to the spirit and a new perspective on life. It clears blockages and refreshes the senses. It allows the passage of the old blood and liquid that travels in the throat, as well as needling celestial chimney to revitalize the senses and spirit. It can also be used when someone's window seems stuck open and who are lost in their own ungrounded perceptions. The lung rules the truth and strength of the voice. The heart will burn speech and the tongue. Red might process here with yin wei mai. Red mai controls the yin, and yin wei mai preserves and maintains it. Yin wei mai meets with red mai at REN22 and 23 and passes to the top of the head. When yin wei mai is disordered, there may be pain in the heart, loss of will, and depression. Ren Mei and Yin Wei Mai nourishes the heart by restoring the yin essence and blood needed to stabilize the heart. So its proper relationship with the spirit, its communication, the command, the sampu can be resumed. Regulates the lung, strongly promotes the descending and diffusing of lung qi, moves stagnation of qi, transforms phlegm and promotes expulsion of phlegm, clears lung heat and moistens the throat, restores the voice. Thank you for your attention.
Still on common cold and influenza, today we discuss the patterns, stomach and spleen damp heat. Clinical manifestations, continuous fever that decreases after sweating but then returns, a feeling of heaviness of the body and head, a feeling of oppression of the chest and epigastrium, nausea, loose stool, sticky taste, tongue red with a sticky yellow coating, pulse slippery and rapid. This type of pattern is a frequent outcome of invasion of wind heat when it reaches the chi level. Damp heat in the center may easily become chronic in the form of residual pathogenic factor, giving rise to some forms of chronic fatigue syndromes. Treatment principle: resolve dampness, harmonize stomach, strengthen spleen. Points: spleen 9, spleen 6, REN12, REN13, REN10, stomach 36, bladder 20. Reducing method on all points except stomach 36 and bladder 20, which should be reinforced. Spleen 9 and spleen 6 resolve dampness. REN12 resolves dampness. REN13 subdues rebellious stomach chi. REN10 stimulates descending of stomach chi. Stomach 36 and bladder 20 tonify the spleen to resolve dampness. Case history. We have a 42-year-old man who presented with acute diarrhea with foul-smelling stools, feeling of heaviness, light temperature, feeling of fullness of the epigastrium and poor appetite. His pulse was slippery and slightly rapid. Tongue was red with sticky yellow coating. Patient was successfully treated the year before for chronic ulcerative colitis. Diagnosis: this is a clear example of damp heat in the stomach and intestines at the Qi level. He was obviously prone to this due to the previous problem in the intestines. Treatment principle adopted was to restore the sending of stomach Qi and ascending of spleen Qi, resolve dampness and clear heat. Prognosis and prevention. The combination of acupuncture and herbal medicine is very effective in treating exterior invasions of wind. The beauty of Chinese medicine in the treatment of colds and influenza is that if the treatment is absolutely right, the exterior is released and the pathogenic factor expelled completely. It also shortens the course of the disease and prevents complications and injury of Qi or Yin. The use of antibiotics during exterior invasion of wind or at the Qi level should definitely be discouraged, except in severe infections. Although the common cold and influenza are caused by viruses against which antibiotics are ineffective, they are often prescribed for secondary bacterial infections of the throat or tonsils, for example. In many cases, the use of antibiotics in these conditions leads to the development of a residual pathogenic factor. Also because they weaken stomach Qi, which is the source of Qi and blood of the body, so that the body's defenses are enfeebled rather than strengthened. Of course, in some situations, intervention with antibiotic therapy is necessary, as when Chinese medicine might be too slow to act. For example, if a small child develops pneumonia following influenza, it is obviously important to administer antibiotics to act quickly and prevent injury of yin from heat or the development of wind from heat. Moreover, a small child with pneumonia will have a very high temperature and probably delirium, so that it would be very difficult to administer herbs in any case. It is essential that the patient be advised to take care and rest during wind invasion. He should also avoid sexual activity at this time. Not taking care and overworking when the body is attacked by pathogenic wind is the most common cause for the progression of the pathogenic factor into the interior, and moreover, for the development of residual heat. Residual heat or damp heat is one of the causes of the development of post-viral fatigue syndromes. If a person is particularly prone to colds and flu due to a deficiency of defensive Qi, one can tonify with moxa the following points: bladder 12, bladder 13, do 12, and stomach 36. This treatment should be given 3 times a week for a month, and the best time to administer it is between the middle of August and middle of September. Thank you so much for your attention.